You are watching McLaren Port Huron Today's Health Program, and I'm speaking with breast surgeon Dr. Kimberley Clark-Paul about breast cancer care treatment. So Dr. Clark-Paul, just for a review, can you tell us a little bit about the symptoms or what a woman might experience if she suspects maybe breast cancer?
Absolutely. So I think probably one of the important things is, first of all, most of the time we diagnose breast cancer by an abnormal mammogram or an abnormal ultrasound. So by the time the patient is having symptoms, the tumor tends to be more advanced. So please don't wait until you have symptoms. Please get your mammogram or your breast imaging modality as your primary care doctor would recommend, and usually that's once a year. So that's number one. Number two, symptoms, any change in the breast, any dimpling, any retraction of the breast, any inversion of the nipple, those are all warning signals. Any lumps in the breast, and unfortunately recently we've seen a fair number of patients who have actually very advanced disease with multiple lesions on their breast, non-healing sores. All of those things would be things to look for to get it checked out. Now what's interesting is typically pain is not usually associated with breast cancer. Now when the tumor becomes big enough it can, and it could be, so if you're having pain in your breast, get that checked as well. But the most important take-home message from this is get your mammogram, because if you do have a tumor, the thing that makes the difference is that we find it early and treat it early.
Yeah, so it really is important for women to be familiar and
yes.
take that annual exam, very important.
Yes.
Yeah. Talk a little bit about maybe the surgical options that a patient might have.
So surgical treatment has changed dramatically over the years. It used to be that surgical treatment, women would get a radical mastectomy. That meant not only removing the breast, but removing the muscles of the chest wall and the lymph nodes under the arm. We moved from that to what's called a lumpectomy, and we found that survival was the same whether you had a lumpectomy, or especially if you had radiation afterwards, or whether you had the mastectomy. So it was less deforming, certainly less deforming, but cosmetically there were still some very bad outcomes, bad results. In clothes, maybe the woman looked okay, but cosmetically otherwise it was a problem. And now we've moved most recently to what's called oncoplastic surgery. And that's really a passion of mine. So my goal is to remove the tumor, and I've actually had patients come in and I have to say, I am so sorry, but which side did we do this on? Or the patient comes in and says, you know what? I like the side you operated on better than the other side. And so that's what we're moving to. Number one, my first goal is to remove the tumor so it can never come back. And number two, to do it in the most cosmetically acceptable way possible. So we can't always do that, but when we can, that's what the woman deserves. Now, that's when we're talking about lumpectomy. We also, sometimes it's necessary to remove the breast, and then reconstruction is an option. And there are multiple different types of reconstruction. Most commonly, we do what's called a subpectoral implant. But there are different things that we would talk to a plastic surgeon about for that. Other thing is, not only in surgical treatment do we treat the breast, but we sample and sometimes remove the lymph nodes under the arm. And that's called a sentinel node biopsy, or if we need to, an axillary node dissection.
Which, that's a good point. Like, how is breast cancer actually diagnosed? So you talked a little bit about the node biopsy, but maybe we need to go back a little bit and talk about the initial
most of the time,
diagnosis.
I would say probably 100% of the time, by the time we remember I said we make a flight plan? Well, we don't make that flight plan until we have a diagnosis typically. And the diagnosis, almost 100% now, is made with a core biopsy. So we do that without going to the operating room. If we feel something abnormal or we see something abnormal radiographically, we take a small needle and we anesthetize the area. We're able to go into the area and get a sample of tissue and then get the diagnosis. Now, occasionally we'll do a core biopsy, and radiographically the lesion looks very suspicious, and the core biopsy comes back as breast tissue or not a cancer. In that case, we may have to go to the operating room and remove the area. But by far the majority of time, we know that the patient has a cancer before we ever go to the operating room.
Yeah, so which really kind of helps you make that plan as you go.
Absolutely.
Yeah. What are some of the common questions that women have when they're facing a breast cancer surgery?
I think that when women come to me, I think there's been in the past, such a thought that you would have to have your breast removed. And so when the patient comes, they want to know, first of all, they want to know what stage disease they have. They're pretty smart about knowing what's going on because the stage of disease helps determine what kind of treatment and what kind of prognosis they'll have. So they want to know what kind of stage and what kind of surgical options we have. And again, surgical options can go from removing the breast to doing a lumpectomy. Often when we do a lumpectomy, the majority of the time the patient will then require radiation as well, so they need to know that as well. But those are the questions that they have.
Yeah, this has really been great information for us. Thank you so much for speaking with us today.
My pleasure.
And thank you for joining us. We do need to take a short break, but we will return after a moment.